Welcome to the Center for Sexual Health and Education. Let's talk about lab testing for hormones. Every day someone comes in and wants their hormones tested, as though something magical is going to come up on the laboratory that's going to pinpoint their problem and I'm going to be able to fix it. Unfortunately, that's not how our hormones work. It's interesting because the age ranges of those who ask to be tested can be as young as 28 and, of course, as old as 60. When the ladies are in menopause, I often make comments like, I don't need a lab test to tell me what your estrogen level is. Since you're not taking any estrogen, your estrogen level is low or undetectable. And so that really is just to emphasize the point that I want to treat your symptoms, not your blood work. Sometimes the blood work is necessary. So if I have a 30-year-old who hasn't had a period in a year, yes, I want hormone levels to tell me what's going on with her ovaries and help me decide what the path of treatment is. Is it premature ovarian failure or something else? At 55 with no period for 2 years, I'm less inclined to begin with hormone testing because I want to treat the symptoms that my patient is experiencing, not any particular number. The second problem with laboratory numbers is that the laboratory number does not reflect what's going on inside the cell. It tells me what's going on inside the bloodstream, and hormones act within the cell. So it doesn't give me an accurate picture all the time of exactly what I need to know. So again, listening to the patient and hearing what's bothering her and trying to address that problem is often more beneficial than getting laboratory. You'll hear that salivary testing is better than blood testing. Well, I'll have to agree that it's better in regards to the stick from the needle. However, those of us who have had needle sticks for blood work throughout our lives, generally it's not a remarkable discomfort or anything that ruins our day. So yes, in fact, in regards to the discomfort from a needle, salivary testing would be better. But as far as accuracy, it is certainly no more accurate. Some would argue that there are several flaws that can occur in salivary testing in regards to what the patient took in the mouth within the half hour or hour prior to the test that may disturb the saliva that's being measured and therefore not give an accurate result. Some would argue that maybe some of the salivary testing labs do not have good data as to their accuracy. Regardless, your insurance covers your blood work testing in the event that blood work is needed, so having to head in the direction of salivary testing does not help us take any better care of you. Now, if we are drawing labs, then some of the labs that we would be interested in are your estradiol level, but that's assuming that I'm giving you estradiol for treatment. If you're taking a product like Premarin or Prempro, measuring an estradiol level is useless. If you're on birth control pills, taking an estradiol level is useless as well. So it depends on what I'm looking for. Testosterone levels, again, are somewhat helpful, somewhat not, but if we generally think that we want to be in the upper 50th percentile of the result for testosterone, maybe that's a basic goal for people to try and remember. When we're giving DAGA, we actually want to measure DAGA-S, the sulfated version. So DAGA-S is what's ordered on the lab test. Measuring estrone in menopause is not very helpful to me. In a lady with ovaries in menopause, that's what her ovaries are making, estrone, and it's a very weak estrogen, so that is not a very helpful number in our clinic. But I just want you to understand that there is a role for laboratory testing in certain circumstances. It's not the routine be-all, end-all. It's not going to give us a magical cure for you. What we'd rather have is a nice, clear history of how you're feeling, what you want to improve, and we can make you feel better without all of the blood tests and laboratory tests, but rather to listen to the patient, hear the story, understand what's naturally going on in that age group. I think we can make you feel better regardless of your age. So come talk to us at the Center for Sexual Health and Education and see if we can't make you feel better. www.bestsexualadvice.com